This is Dr. Aydah Al Awadhi reporting to you all the way from ASCO 2025. As you know, hormone receptor positive, HER2 negative metastatic breast cancer remains challenging, especially as resistance to endocrine therapy develops over time. SERENA-6 introduces a new concept of progression, and instead of waiting for radiographic progression, the study explores molecular progression detected through rising ESR1 mutations. This approach may allow earlier intervention, potentially delaying clinical progression and preserving quality of life. The study aimed to determine whether camizestrant, a potent next-generation oral selective estrogen receptor degrader, when administered in response to molecular progression, could improve progression-free survival compared to waiting for radiographic progression in hormone receptor-positive, HER2-negative metastatic breast cancer. Camizestrant works as a complete ER antagonist that binds to wild-type ER and mutant ER and targets both for proteasome-mediated degradation, preventing ER-driven transcriptional changes and delaying the emergence of resistant mechanism in ER signaling pathway. Patient clinically stable on first-line aromatase inhibitors but showing ESR mutations in circulating tumor DNA were switched early to camizestrant. Results presented at ASCO 2025 showed that camizestrant is the first next-generation SERD to demonstrate superiority to AI when combined with all three widely approved CDK4/6 inhibitors, with a highly statistically significant and clinically meaningful 56% reduction in the risk of progression or death, with median PFS of 16 months versus 9.2 months and a hazard ratio of 0.44, which was consistent across all key subgroups and with a trend towards benefit in PFS too. Another key finding is that patient quality of life in first line was maintained for longer with camizestrant plus CDK4/6 inhibitors, delaying median time to deterioration by 3.5-fold versus AI plus CDK4/6 inhibitors, which was 23 versus 6.4 months. So in SERENA-6, camizestrant plus CDK4/6 inhibitor show a well-tolerated safety profile with a low treatment discontinuation rate, about 1%, and infrequent and low-grade GI toxicities. These findings are favoring this preemptive intervention strategy over traditional approaches that wait for visible disease progression. This study reinforces the importance of circulating tumor DNA monitoring beyond initial baseline mutation testing. It suggests a shift toward longitudinal biomarker surveillance, allowing earlier intervention strategies that could improve outcomes for patients. So SERENA-6, alongside studies like PADA-1, is redefining endocrine-resistant management by detecting and addressing resistance before it becomes clinically apparent. The future of hormone receptor-positive, HER2-negative metastatic breast cancer treatment lies in catching resistance early, acting on it strategically, and keeping patients ahead of their disease.